Now, let's move forward with the treatment. Given that that process of inflammation and the release of inflammatory chemical mediators causes bronchoconstriction. Treatment would then follow that we want to reverse that bronchoconstriction. Because you have to remember, pharmacology is just an offshoot of pathophysiology. So if it causes bronchoconstriction, by golly, we want a pharmacotherapeutic agent that will cause the opposite of that, and that is to open the airways, and that's what we call the process of bronchodilation, to allow air to come in and out of those airways. Those bronchodilators, we call them the beta-2 receptor agonist. You have to remember that the smooth muscle of this airway here contains large receptor sites of beta-2. And once we stimulate that beta-2, that opens and results in bronchodilation of the airways. Now, we have different categories of those bronchodilators. We have what we call the short-acting beta-2 agonist, long-acting beta-2 agonist. There could also be the old drugs, which is the xanthan, and we have the anticholinergic categories of medication to treat asthma. One of the most important in this bronchodilation category is the short-acting beta-2 agonist, which I could put it here, rescue medication, because if this is the short-acting bronchodilator, that if a patient has a symptom of asthma, we want them to use this immediately to cause that bronchodilation and allow them to breathe. And that's why it's called rescue medication. And this is the inhaler that any asthma patient has with them. And as nurses, we tell them that they should have it with them at all times and make sure that they are not expired. These medications can be delivered through a metered dose inhaler, through a small volume nebulizer, and others can be delivered with a dry powdered inhaler. But the dry powder inhaler are mostly your corticosteroids, which again is another medication or treatment for asthma. Glucocorticoids is considered anti-inflammatory. And again, anti-inflammatory, it follows because of the inflammation that is triggered by that mast cell degranulation. And so we give glucocorticoids. It could be also again given through a dry powdered inhaler or through a metered dose inhaler or intravenously or orally through medication by tablet, and if peds a liquid. So these are the medications that help with anti-inflammatory medication to help combat inflammation. Other medications are leukotriene modifiers, mast cell stabilizers, antihistamine. If you recall again, when we go back to that degranulation of that mast cell, it releases all these chemical mediators for inflammation. And so if it's released, we want to modify their effect. So this is why I call it a leukotriene modifier. We want to modify their effect on the body so that they don't have any symptoms. And if we can help it, we would like to stabilize that mast cell so that in case that individual is encountering the allergen, their mast cell is stable enough not to degranulate and release those chemical mediators. The other one is antihistamine. If somebody who has allergies, then we want them to have maintenance of antihistamine, or what we call the common anti-allergy medication that is available over the counter as well. So these are just a couple of medications that are used in the treatment of asthma. And all of this asthma, in terms of treatment goals, we are all trying to reduce risk for this patient, reduce complication. All of this medication are geared towards those goals in terms of treatment of asthma. We have also what we call the step therapy. This depends on how often the symptoms occur of coughing, shortness of breath, wheezing. Keep in mind that anybody who's using their rescue nebulizer, their rescue medication twice a week, that is not a well-controlled asthma. So keep that in mind when you are teaching patients with their asthma. So they usually will be having, depending on their symptoms, they might have all these other different medications until when it's really well controlled and all they need is the short-acting beta agonist as needed. This person will benefit from what we call the action plan. If you remember, this is what you call your peak flow meter. The peak flow meter allows that person to monitor their lung function during expiration. So they are forcefully exhaling into this machine or this device, and this red will move either to the green, yellow, and red. And this is what it means. If it's green, they're good. If it's yellow, they need to do something and take their long-term control asthma medications. If they're red, they need to get help. So this allows them to monitor basically where they are in terms of their treatment. These are information. When we teach patients, we tell them and we direct them to valid and credible sites, such as your NIH and your CDC, so that they can get information for themselves, participate in their care, and allow the patient to be partners in preventing asthma. Now we move on to lifestyle changes that we need to instruct our patients so that they can prevent asthma attacks. Ways to prevent asthma attack. As I have mentioned in the pathophysiology before, the most important thing is allergen avoidance. So avoidance of triggers, whatever it may be, perfume, cigarette smoke, animal dander, pollen, that is the number one thing that needs to be done. Allergen avoidance. Also minimize exposure to cigarette smoke. We already know that some people, and because of the inhalant that the smoke can have an effect on an individual, that will also trigger an asthma attack, so we tell them to minimize exposure to cigarette smoke. For those who love pets, avoid having pets in the bedroom and furniture. And if you can't do that and you really want to do that, you may have to be on antihistamine or anti-allergy medication. This is something that you have to work with your primary care provider to be in partner with in what you can and cannot do. But these are the ways to prevent asthma that we can teach our patient as much as possible. Also, during spring season, we teach our patients to stay indoors if possible during peak pollen days, because we already know that pollen is one of the allergen trigger for an asthma attack. Also, for those patients who have an exercise-induced asthma, they need to use rescue inhaler before engaging in any exercise or activity that will trigger their asthma secondary to that exercise. And lastly, the use of the peak flow meter. I talked about that earlier under the pathophysiology discussion about the use of that peak flow meter and how a person with asthma can participate in their care by monitoring their peak flow meter rates and manage their asthma accordingly according to their asthma action plan. This ends this video on the treatment and lifestyle changes on asthma.